Hello, everyone. Welcome to day 5 and our last day of the Preemie Health Talks. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Preemie Health Talks is the first international live series that CPBF is hosting in 2021. These educational sessions are in collaboration with the Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, the Canadian Neonatal Network, the European Foundation for the Care of Newborn Infants, EFCNI, and GLANS, the Global Alliance for Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to empower families of premature babies every step of the way through support and education. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their babies. For these Preemie Health Talks, we brought health experts from around the world and from all over Canada. We've been diving deep into topics affecting preemie health, from breastfeeding to parental mental health during the pandemic, from the importance of kangaroo care to the best practices to protect your baby's skin. If you need closed captioning, you can watch it live from our YouTube channel and enable closed captioning on the screen. I want to thank our sponsors, Medela, Water Wipes, and Prolacta Bioscience for their ongoing support. Please use the comment area below your screen to ask questions, to share your perspective and stories. Today we have 2 presentations, one with Diane Schultz talk about Kangaroo Care, and the second one I have Misty Williams talking on skincare. And right now we're going to talk about Kangaroo Care and COVID-19. May 15th, as many of you might know, is International Kangaroo Care Day. And we have to continue to raise awareness on the importance of kangaroo care for premature babies. Kangaroo care is a form of holding in which a baby is placed on the chest of a parent or other adult in direct skin-to-skin contact. In 1978, a doctor in Colombia who was faced with a shortage of caregivers and a lack of resources started promoting kangaroo care in his hospital. The babies who were held by the parents thrived, and now the practice of kangaroo care is recognized internationally as a wonderful way to help both babies and their parents. And we need to recognize the importance of skin-to-skin care, also kangaroo care, during the pandemic, and how our NICU families' mental health has been affected due to restricted parental presence. In the NICU, we are building the future. Having parents at the bedside being parents is so needed. Kangaroo care plays a huge part in building that connection within the family. It enables parents to be the most important caregivers. We need to make every effort to keep that connection intact. And I have here joining me live from Winnipeg, Manitoba, Diane Schultz, who is a kangaroo care champion. Diane has been a bedside nurse for 32 years in the NICU at St. Boniface Hospital in Winnipeg, Manitoba, where she's been actively involved in improving patient and family care. She's the co-chair for the NICU's Five Care Committee and sits on many committees at the hospital, aiming to educate all staff on kangaroo care at all levels. She's also a member of the National Five Care Steering Committee and co-producer of a safe transfer video for kangaroo care that has been shared internationally. Throughout her career, Diane has been a strong advocate for patients and their families. Diane, thank you so much for joining us here today.
Thanks for having me, Fabiana.
It's always great to talk to you. You always share your passion, and families absolutely love you. Every time you post something, I see all the parents commenting on how they appreciate you and everything you do for them. So I'm very grateful that we are here today to talk about kangaroo care, in anticipation of International Kangaroo Care Day next week. So let's talk about what happened with kangaroo care and skin-to-skin over the last year with the pandemic. What have you learned?
So across the world, there's been many different restrictions brought up with COVID. Parents are not allowed to be at the bedside as much as they used to be. I feel family integrated care has been greatly affected by this too, with these restrictions in place. In our unit, we actually are pretty liberal compared to some units. We don't restrict our parents to length of time, but they are not able to be at the bedside together. So it's only one parent at a time. So that does greatly affect all their celebrations at the bedside, receiving bad news at the bedside. And I think it's probably affected the amount of time they do Kangaroo Care, because a lot of our parents would come and sit at the bedside together while one was holding skin to skin or Kangaroo Care. So I think it has affected it somewhat. We make every effort to encourage and promote Kangaroo Care, but with all the restrictions in place and orange, red, green levels, it has affected things.
Absolutely. Before we continue, because Diane is not going to have a formal presentation, so you guys can share with us your experiences, ask questions, but I'm going to share one, first of all, from Lori Romas. Hi from Kenora. Baby Scott says hi to Auntie Diane. We are so fortunate to have her as our nurse. She holds a very special place in our hearts. Thank you, Lori, for joining us here today.
Yeah.
And then we also have Sarah and baby Lachlan from Barrie. We are so excited for today. It has been such a great experience. Thank you for joining us, Sarah. Sarah's been here with us the entire week. Diane, you see how important nurses are for parents and for us to continue to educate parents that way, and how important it is for us to continue to educate parents on Kangaroo Care.
It's so important. Every parent needs to be fully educated on the benefits of Kangaroo Care, why we do it, and that it's important to continue it even when the baby is stable. I was just in a Q&A this morning with some other individuals, and a lot of times when the baby is more stable, in a crib, bundled, everyone thinks the way to hold a baby is bundle held, so you can look at your baby. That is one of the disadvantages of skin to skin or Kangaroo Care, is that if you're holding them properly, you actually can't see your baby. But it is so important to continue that skin to skin when that baby is stable, because you have to make up for all the missed Kangaroo Care time that they weren't able to do when they were unstable. So there's so much, the benefits just continue on forever. Basically until the baby tells you they're done.
So let's talk about the benefits, because people might not be aware of all the benefits for Kangaroo Care. There's several benefits for Kangaroo Care. Let's highlight what parents should know about it, but also if there's any healthcare professional here, how important it is to teach the parents on those benefits.
Right. So Kangaroo Care has been highly researched too. If you ever want to, like as a professional, want to see the benefits, you can go on the Kangaroo Care bibliography that is maintained by Susie Luddington. The practice of Kangaroo Care or skin to skin is a diaper-clad baby held bare chest to bare chest, ventral surface to ventral surface on its caregiver. So it could be a mother, father, grandparent, sibling. There really is no restriction to who the caregiver is. And a comment I've heard is that a bare chest is better than anything. It doesn't matter. So many benefits. Thermoregulation is just kind of a given, and the mother will automatically thermoregulate that baby with her breasts. Women are hormonally driven. If you put twins on, each breast actually works independently to thermoregulate each twin. And we've talked about this before. We have done triplets, and we've never had a thermoregulation problem with the triplets either. Brain maturation is huge, and that's because the baby gets good, regular sleep when they're in skin to skin, as compared to in the crib, on the open bed, in the isolette. They don't get the same amount of healing REM sleep as they do when they're held skin to skin or Kangaroo Care. And that research has been proven many times over. And when you're in that deep REM sleep, you're actually maturing your brain. So the parent is actually growing their child's brain when they're holding them skin to skin. For pain control too, skin to skin and breastfeeding together work better than anything, because it actually blunts the pain response in the brain, which reduces your memory of pain, which reduces the trauma that you feel afterwards, because pain will actually follow you long term. So, and it works better than anything. I know we use sucrose a lot. It works better than sucrose. So I've started many IVs, collected blood work, done heel pokes while babies have been skin to skin. So it's very important, again, for that caregiver to be at the bedside, helping the team care for that baby. Benefits for the mother: it greatly reduces postpartum depression. and for the father. Postpartum depression in dads is actually very underreported. They say it's about 1 in 10, but they still feel that is extremely underreported. And I've had nurses come to me and tell me that they've watched a dad fall in love with their baby by holding them skin to skin and holding a mirror, being able to look at them. So the connection that you lose when you don't do skin to skin actually does more damage. Postpartum hemorrhage is reduced for the mom too when you hold skin to skin. It increases breastfeeding rates, duration, and her volume of breast milk too. So there's just so many benefits for us to be doing this. In our unit, we do skin to skin on basically every baby other than babies that are actively cooling until they have been rewarmed. We also don't do babies with chest tubes in, just because that chest tube can be quite painful to move that baby with. And our chest tubes generally do not stay in very long. So we do wait for that. But we generally hold all our babies skin to skin, even if they have a breathing tube in. Many babies we have are on CPAP. We hold them all skin to skin. And we also accommodate the position too, depending on the baby or depending on the caregiver. You can always rearrange the position of the baby to make it work too.
So I'm going to share comments here because you mentioned having the mirror, and Sarah said her nurse would give her a mirror so they could see the baby while providing skin to skin. Such a great idea and a great tool. So you can see the baby and you don't look at the monitor, right? You can see the baby's breathing well, everything is okay, and you still see how cute they are and how cozy they feel. We have here a comment or maybe a question from Wendy. Hi, Wendy. Thank you for joining us here. How do we overcome the ongoing barrier at the bedside? The nurse who tells the parents it's better not to hold him right now. This makes me so sad that despite all the known benefits, there are nurses who say this, and baby as well.
It's an ongoing issue. You really need champions in your unit. You really need your staff to firmly believe in the benefits for skin to skin. And it takes a long time. We've been going at it now for over 10 years in our unit, and it's a continual process. You always have to educate and support the staff. You always have to educate and support your families too, as well as your medical staff too. And also our respiratory therapists are involved in the transfer process too. So it takes a village to do this, but it is an ongoing process. In the session that I was in this morning, one of the people spoke about interviewing a dad who had a 24-weeker who was on his way getting prepared to go home. He really did not hold that baby. And what the nurse told him was they were giving compassionate neglect to the baby. I just couldn't believe that the nurse would even say that. Neglect is neglect. It doesn't matter if you think you're doing it compassionately or not. It is not. So we really need to firmly believe, one, that the parents are the most important caregiver at the bedside, and that they need to connect with that baby. When you separate the baby from its mother, you do cause neurodevelopmental damage. So we should make every effort not to separate the parents from the baby at any time and include them at the bedside. Even if the baby is unstable and not able to be held at that point, there's no reason for them not to be able to hold, touch their baby, speak to their baby, sing to their baby, read to their baby. They should always be a presence for that baby.
Absolutely. So Wendy added in her comment, our team is awesome, but there are always those outliers who say these things to families. Well, Wendy, I can say yes, because when my son was also in hospital for 5 months, I had those conversations. It's better not to hold him today. So Tanya here comment, hi Tanya, do you skin to skin with babies on high frequency? That is such a great question. Diane. Yeah. The village that you need for that moment to happen.
So I'm assuming she means the jet ventilator. Yes, we do. So it has taken us a process. And when we went to Bogota for the International Kangaroo Care Mother Day Conference, I'm saying it wrong, somebody from the Scandinavian countries got up and spoke, and she said, you can't get good at something you don't do. So you're not going to get good at it if you don't do it and keep on doing it. And I use that term for mothers that are breastfeeding too. because you can't attempt a breastfeed one time and then be good at it, or have the baby be good at it. It's a practice, it's a learning all the time. So we do teach our staff all levels of care, how to transfer those babies in skin to skin Kangaroo Care, and we practice it. We did create that video. When we do babies on the jet, or any baby that is intubated, we only do the nurse transfer, which is a sandwich transfer. And then we have at least 3 people, sometimes 4 people, sometimes 5 people involved in the transfer. We have a briefing beforehand with the parent. We make sure that everyone knows that if they're uncomfortable anytime during the process, they can stop or halt the process. We will correct what is going on and then continue. And then we try and do a debriefing afterwards too, just to make sure that we talk our way through it and what has gone well, what hasn't. Since we've actually started doing the nurse transfer with our intubated babies, we haven't, I like to say, I think it's been 1, but I don't think we've had a baby extubate during the transfer process. So it's not impossible. You just have to think your way through it, go slow, and for sure, have a look at the video. It is a simulation for the first half. We didn't want to use our actual unstable patients for the transfer of in the video. So we used recessed dolls, and we borrowed some parents to do the simulation part, and then we used real babies at the end of it that were more stable. So, but yeah, we do our babies on the jet.
So I'm sharing here the URL is a very long one, but you can take a screenshot of this. The video is there. It is a great video. Diane, talk a little bit more about this video. Can any hospital apply the techniques that you share in this video? I saw this video in a conference when you presented. It's about 20 minutes long, and there's so much great information there. Can this be applied in any unit?
I don't see why not. Every unit is different. We are a unit that has pods. We don't have single patient rooms, so we actually are very restricted with space at the bedside, and we're able to do it with our very sick babies. So I don't see why any unit couldn't do it. Again, it's practice. We did have a lot of trial and error in the very beginning when we really started to increase our skin-to-skin Kangaroo Care time, and we learned a lot from doing it. But I learn every time I transfer a baby, because every baby is an individual, every parent is an individual. So every time I transfer a baby, there's always something to learn from it. You just want to make sure that you do it as safe as possible, but for sure any unit could do it.
Okay, so let's share some of the pictures that you share with us. Because here you have a picture of baby on a ventilator. So talk about those pictures, and let me know when I need to move from the next slide, because I think those pictures are so important for everyone to see what is possible when there is a willingness and a team work happening in your unit.
Yeah. So this is Owen. I think the second picture is, well, it is him again, but he's on CPAP. Yeah. So this was before I think we started doing the nurse transfer for the intubated babies. And we actually had our parents do the transfer for our intubated babies. But then we thought, if something were to go wrong, if the baby did extubate, we didn't want the parents to feel that it was their fault or they caused some part of that. So we thought it was more stable for us because we handle these babies more. And if the mother has had a fresh C-section, or if they're nervous in any way, you don't want it to be a bad experience. You want it to be a really good experience. So we started to work more with our transfer technique. Once the baby is extubated, generally those parents are that much more comfortable in handling their baby, and they're more willing and more able to do the parent transfer, where they actually pick up the baby. We still assist them, but it's a different type of transfer.
Okay.
So, and Owen, I want to say, was born at 25 weeks. Yeah.
And here you have another parent on CPAP.
Yeah. So, and these are our chairs, and there's our mom with the mirror too. So we do have a mirror at every bedside for each parent. I really wish we had some sort of bracket to go on our chairs, because again, we're only allowed to have one parent at the bedside. What we have done in the past is when we had both parents there, one parent would hold the mirror for the other one. So now our parents are having to hold the mirror too, and sometimes it gets a little uncomfortable. So it would be handy. We're trying to think of a way that we could actually devise something so we could hold the mirror beside the mother or the caregiver and the baby.
Okay, and I brought this picture.
Oh.
Actually me holding Gabriel on a high frequency ventilator. And that was the first time I actually held him on ventilator because he was on CPAP before. And as Diane said, it took a team to do that. I remember that day was probably 4 or 5 people around us. And I remember the RT holding the tube so I could actually breathe, because obviously I was so nervous about this that I stopped breathing because I was like, okay, what if I extubate Gabriel accidentally? But it was such an important moment, and he was so very sick on those days, especially that day when they took that picture. So it's so important for parents, and those things that we always remember, like how, that feeling of holding baby skin to skin and the warmth, and, it just calms you down as a parent.
Yeah, it decreases everyone's cortisol. So it really calms everybody down. So yeah, it's very important to do. Some babies in our unit I know have had to wait weeks to be held just because of different situations. And it does take a village to transfer the baby. But it's interesting with some of our babies, those parents become the experts in the transfer technique, and they watch everything that you do. So if you're new to the baby and you come on to transfer this baby, the parent will actually tell you, no, this is how we do it, and it actually works this way. So skin to skin Kangaroo Care actually does really empower the parent, because it's something that only they can do. We can't do it as staff.
Absolutely. Diane, let's talk about tips for parents who are going to hold Kangaroo Care, because sometimes you spend an hour, 2 hours on the chair, going to the washroom before, pumping before. What do you suggest and recommend to parents?
Yeah. So before we hold, we do have a conversation. We recommend that they use the washroom facilities prior to, have a snack, have something to drink if they need to do that. Certainly pump breast milk, because once you're in the chair, I have had moms actually pump while holding skin to skin, but that was when we had a dad at the bedside too. So with our parents being there by themselves, it's important because you don't want to become engorged or leak all over the place. So it's important for our moms to pump beforehand too. Make sure that if you have pain, that you take something for pain control too prior. So for babies born less than 33 weeks, we really, in our unit, we push for a minimum of 60 minutes, just so that baby will go through a complete sleep cycle. And it does take a process for them to come out, and it's the longer time. We've had parents sit in the chair for 6 to 8 hours, and we can do care for that baby while that baby is on the caregiver too. So they actually recommend babies born less than 33 weeks, or even corrected less than 33 weeks, to stay out for a good 70 to 90 minutes, because their sleep cycle takes longer. 33 weeks and above, the sleep cycle is about 60 minutes. But in the research, it actually states that even 20 minutes of skin-to-skin Kangaroo Care is beneficial. So you just want to make sure that that parent is able to sit in the chair. We do have specific chairs for holding skin-to-skin. We recline them. You should always be about at least 30 degrees off of midline reclined. It's easier for the baby to breathe, and it decreases blood pooling for the mother in her legs too. But we get them all comfy. We prop them up with towels or gowns underneath their arms, because your arms will get tired holding. You want to make sure that they're as comfortable as possible so they can sit there as long as possible. But yeah, you can change a diaper while that baby is out skin to skin. We feed all our babies while they're out skin to skin. So there's many things that you can do while the baby is being held.
Okay, let's talk about chairs, because there's a lot of hospitals that we don't have the right chairs to do Kangaroo Care. So I heard this not only in Canada, but in other places. We do a lot of work with international organizations. But I have to tell you, a few years ago, I did go to Bogota, and I did visit a public hospital in Bogota, and they have those white pool chairs, the little plastic white chair that we sit here outside, and moms are doing Kangaroo Care on that chair. Right? Obviously, it's not as comfortable, but it's doable.
Yeah, Before we got any type of recliner chair, we did have hard wipeable chairs that our parents would sit in. And we had one mom who held her baby on the jet for 6 hours the very first time in one of those hard, uncomfortable chairs. So it's amazing what our parents will do. But we do have Lafuma recliners. I don't know if I can say that, but that's the chair that we use. They're made specifically for hospitals. They work very well. They recline, they lock. They're good up to 310 pounds, and they're fully wipeable too.
Okay, so Diane, now with all these restrictions happening in hospitals around the world, and we know, the kangaroo care is not happening at the same way it was happening before. So what do you recommend hospitals to do at this time when there's so many restrictions and one parent at a time in a lot of hospitals, one parent full stop? So what do you recommend hospitals or parents do?
Well, in my ideal world, it would be something totally different than what's going on. Every hospital, every province, every country has so many different restrictions. Like even our country, every province is different in their restrictions, and the restrictions for parents at the bedside. It would be amazing if we could have both parents at the bedside with no time restrictions. That would be, before COVID happened, we were already in semi-lockdown because of RSV, and only parents were allowed in anyways. So I think it would make a huge difference if you could have both parents at the bedside together and with no time restrictions.
Absolutely. So we have a question here from Sherry. Sherry, thank you for joining us. Should there anything done differently when baby is brought home? In terms of kangaroo care, I assume, or holding the way you hold the baby at home?
I'm assuming kangaroo care. So you can certainly do kangaroo care skin to skin once you're discharged at home. Again, kangaroo care skin to skin does come with safety issues. You always want to make sure that you're safe when you're doing it. In our unit, our babies are monitored when they're doing it. So we know if something goes wrong, but we also watch our families while they're holding in skin to skin. Our postpartum parents are taught that when you're doing skin to skin in the hospital, the partner is there with you, monitoring you. Because your oxytocin goes up, which is your cuddle hormone, which makes you very sleepy and tired. So it's not uncommon to fall asleep when you're doing skin to skin. We've had many parents in our unit fall asleep during skin to skin, but we monitor them. Out on the ward and at home, it's something different. So you always want to make sure that you're safe. There are many different types of baby wraps, shirts that can be used. You just want to make sure that you're very safe when you do it, that the baby has an open airway, it's in slightly sniffing position, and that you're safe. But really, I know there is some school of thought out there that term babies don't need skin to skin, but we actually do our term babies at deliveries for the first hour to 2 hours prior to the first feed in skin to skin. So it's highly beneficial.
Right. So I posed some questions to our audience if they want to answer, if they did kangaroo care, if they had to wait until somebody offered for them to hold their babies. So if you want to share with us your thoughts, would be great. In the meantime, I want to share some of the resources that we have here, what Diane was talking about, how to safely do kangaroo care, what is kangaroo care. And if you cannot do kangaroo care, Diane, what are the options for parents? Because we always talk about touch the baby or put a hand on the baby. And I also want to, while you talk about that, I want to also share this PDF that we created for kangaroo care that you can download from our website and share with parents. There's great information, and everything that what Diane was talking about is on this PDF here.
Yeah.
Okay, shall I leave the contact here? So how can parents still touch the baby, Diane, in a safe way for the baby? Because we know the baby is so, sometimes is very sick or is so very sensitive. So how can they safely touch the baby, and how? Through the incubator. So share some tips with us.
So we also do hand hugging if the baby is unable to come out at the present time. The parents should always have their hands in the portholes. To me, you should never have a parent sitting at the bedside staring at their baby. I cannot imagine a time when you shouldn't be able to touch your baby. A lot of times we recommend to parents that they don't rub, but hold your hands comforting the baby, cupping their head, cupping their torso, speaking to them softly, singing to them, reading to them. Always, the baby should always know when you're there too. I always encourage the parents to open up the portholes, let them know that let the baby know that they're there, speak to them, touch them. Human touch is so important, and they're actually doing studies now on adults and human touch. So it's actually kind of going full circle.
Absolutely. Actually, I was reading something yesterday that somebody posted on Twitter, how important it is sometimes when you go into surgery to have a nurse touching and holding your hand the moment you are so scared and anxious, and the benefits of having a healthcare professional touching the patient going to surgery. It's fascinating, right? As human beings, of course, we need the touch, we need the contact, and obviously this is so very important for our babies. There's a comment here from Sarah that her Lachlan was born at 30 weeks, weighing just over 1,100 grams. And the first night I met him, the nurse offered me to hold him. I was so scared, but so beautiful. That is absolutely right. You are scared, but it is a moment that you'll never forget.
Yeah, you shouldn't. The parents also shouldn't have to ask to hold their baby. That should be something that is an automatic. And if the baby is not able to be held at that time, then the conversation should be, what can we do to enable this baby to come out and be held? We should always be thinking about, because when we have a baby that's intubated, the conversation is always, when can we get the tube out? Or if the baby has central lines, the conversation is always, when can we get the lines out? But the conversation is never, when can that baby come out and be held? And if not, what do we need to enable that baby to be held? So, yeah.
Diane, let's talk about the negative implications of not holding the baby or not touching the baby.
So I always kind of think of those orphanages in Russia where the babies were never held, and then people adopted them, and those babies had never been held. So, and they're actually doing studies on adults now with dementia and human touch. So there's many things. It is just so comforting when you hold your baby, comforting for the baby, comforting for the parent. And it makes that family a unit. It just connects that whole family together. And unfortunately, during COVID too, there are no other people that are allowed into the unit, at least not in our place. It's just the parents. So that has made a lot of restriction too, because those grandparents that can't come in and see their grandchild. So, yeah, no, human touch plays.
It is a very sad situation right now that we see, and sometimes, baby passed away, the grandparents don't meet the grandchild. It's devastating. And we've been talking about parental presence in the NICU during the pandemic all along. We have a publication, a lot of advocacy, and it's unfortunate that this is still happening over a year later. But Diane, let's talk about your experience in Colombia. You went to Colombia to learn and teach them what you do here. You shared the video there. So what was your experience going to Colombia, where Kangaroo Care was actually born, and what did you bring back?
It was amazing to go there, actually. We toured a hospital and a clinic too. And it was just amazing because it was just every day. This is what the parents do. They carry their babies around skin to skin. And a lot of them, because of, I guess, their altitude, a lot of those babies go home on oxygen. Mm-hmm. And in the clinic, we saw mothers coming in for follow-up visits, carrying behind them this tank of oxygen with the baby, but the baby was held skin to skin. In the clinic, we met one couple who the mom was holding skin to, and breastfeeding too is just commonplace. It's not hidden. It's just what they do. It's how they raise their children. But we met this one couple, and the dad was so excited to meet us. He took the baby and placed the baby skin to skin and talked us through it. So it's just what they do. It's their culture. Mm-hmm. So I think it's something that we really need to work towards, that making family unit, family holding, baby holding, Kangaroo Care, skin to skin, that it's just what happens. In our hospital too, we do skin to skin. It's protocol at our cesarean sections. And that we've been doing that almost 4 years now. So you can really see the difference in some things with the mother. You can see a difference in the blood loss. I've had many babies latch and breastfeed while they're closing mom up in the OR. So you actually have changed a surgical procedure into a family event. So
Wow,
there's so many things. Yeah.
That is really amazing. So, but let's talk, when we were preparing for this talk, you were talking about the privacy, and if the father or the mom feels comfortable ripping the shirt off in front of the staff. So let's talk about that, because I think this is something important, and it varies by cultural and where you are, your values. So I think it's important to bring it up. And so staff is also aware that those sensitivities.
Yes. So when we first started, I was one of the hot dogs. I was so gung-ho. I was like, no, we're doing this. It's like, no, there's no reason why not. It's like, get your shirt off. Doesn't matter who you are. We would pull the curtains. But as we progressed in the last couple of years, I've really started to wonder and worry about our families, because so many people have experienced trauma in their life. They might, and different cultures are not comfortable in undressing in front of other people. So we have to be very aware that is another question you need to have with either caregiver, mother or father, because both of them, one of them could be uncomfortable. It doesn't matter if it's a male or a female. So that's another conversation that you should have with them. It's like, I will pull the curtain, I will step out. Generally what our parents do is if they have a button-down shirt, then they can open up the shirt. Of course, no bra. But generally what we do is we have a hospital gown open at the front. So our parents will change behind the curtain. So you do need to be respectful of people's privacy and where they're coming from to make sure that they're comfortable with this. In our unit, we do open the curtains once the baby is in skin-to-skin position and parents are covered up, just because we need to be able to monitor that baby. But so we inform them of that too. But we always make every effort to make sure that our parents are fully covered and be respectful of where they're coming from. And you still have some dads who will whip off their shirts wherever. And it's like, now we're like, oh, let me pull the curtain. But if they're comfortable, they're comfortable. And even some of our moms was like, well, everyone's seen it all. So anyway, but you do really need to be respectful of people's cultures and where they're coming from. So that needs to be part of the conversation. As important as Kangaroo Care Skin to Skin is, we do need to be very mindful of the safety and comfort of our parents.
Absolutely, so very important. Yeah. Diane, in regular times, you would be in full force into the Kangaroo Challenge.
Yeah.
A couple of years now, it's been very challenging to do the challenge because of COVID. So give us a little bit of history of the Kangaroo Challenge and the International Kangaroo Care Day.
So the Kangaroo Care-a-thon actually started through Sunnybrook. I want to say about 8 years ago, and we had participated probably 5 or 6. And it was a 2-week-long kangaroo-a-thon where you would monitor all Kangaroo Care skin-to-skin time held in those 2 weeks. And every unit was different. Each year, Sunnybrook would put out a separate challenge for that. Sunnybrook was unable to do it last year. Some places still are doing the kangaroo-a-thon. We did do it last year, but this year we're just celebrating the one day. May 15th is International Kangaroo Care Day. So we are going to celebrate that day. We'll have meals provided for our parents. There will be prizes. There will be things put up on the walls. So it will be a celebration. It's really just to celebrate and recognize and keep people motivated to maintain the practice of skin-to-skin and kangaroo care.
That's so important. And also Dr. Michael Narvi from the Health Science Center in Winnipeg, he's a big kangaroo care advocate. He actually has a kangaroo costume that he wears around the unit during this time. And he's on all his social media at the moment, him dressed as a kangaroo. Dr. Michael Narvi, you got to check it out. It's really cool, right? Like everybody get engaged, that it reinforces the importance of that practice. So I want to share a couple of more comments here from our audience. Lori said, when she was allowed to see her baby, Kangaroo Care was offered. The frontline and ICU nurses were so supportive. Thank you for sharing that, Lori. Lori was in the ICU in the very early days of the pandemic. actually the first week of the pandemic, and there was a lot of restrictions for her there. And also Sarah sharing here why her baby was on CPAP. The nurse always did the transfer. But once he was off, I was able to complete the transfer myself, and it was such an amazing feeling. I felt so empowered. It gave me some sense of normality. Wow, Sarah, this is so important. Thank you for sharing that. Right? How we empower parents to do things, right?
Yeah. And it's so easy for our parents not to feel empowered. Our parents are coming into a strange area with strangers caring for their newborn baby. This is not what they planned for. This is not what they envisioned. So for our parents to actually speak up and ask for things, I think would be very rare and very hard to do. And more like fantastic if they are, but that's our job. It's really our job to enable our parents to be that advocate and support for that baby. They're the ones that are going to be taking this baby home. They're the ones creating the future. They're the ones shaping future societies, not us. I may be there resuscitating a baby with a team, but I'm not the most important caregiver there. It's the parents that are. And we really need to support that and believe in that.
Absolutely. Diane, that is so beautiful. I think that summarize everything that you said today in this talk, because so important. And I'm hoping next year we are here talking about the Kangaroo-a-thon and which hospital is taking the lead, or which parent is taking the lead on Kangaroo Care. So let's stay positive that we have a different scenario next year. Diane, your thoughts for our audience today?
If you can just speak for your baby when you're at the bedside, don't be afraid to ask. All they can say is no, but you got to keep asking. Even if it's scary, you got to keep asking, because you need to hold your baby. It is so important.
Absolutely. And I'm just sharing again the CPBF website with all the information for Kangaroo Care. Diane, but thank you so much for joining us here today. Always a pleasure talking to you. I love to feel your passion and your commitment to these families. You bring so much joy to the life of those families. I'm very grateful to you. Thank you.
Thank you, Fabiana.
Thank you. And for all of you watching us here live from YouTube or Facebook, thank you so much for joining us. We'll be back in just a few minutes with Ms. Williams talking about evidence-based neonatal skincare practices. And I want to thank our sponsors, Medela, Water Wipes, and Prolacta Bioscience for their ongoing support. CPBF is a charitable organization, and 100% of all donations received this week will go to our support programs for families. To donate, you can go to our CanadianPremie.org website. I'm trying to find the link here. And stay tuned, and I'll be back in just a few minutes. Thank you.